This is Dr. Cruz from Kentuckiana Integrative Medicine. Please introduce yourself.
I'm Karen Queen.
And Ms. Queen, is it okay if we put this video on our website and on the internet?
Yes.
Tell the folks a little bit about yourself. What kind of work do you do, and how long have you had your challenge?
Well, I have osteoarthritis of both my knees. My right knee is worse. And I've had this for some years now. And I was able to get by just with getting some gel injections here and there until I tore my meniscus about 4 months ago. And then I couldn't walk on my right knee at all. It was very painful. I was limping and could probably only walk with a cane until I saw Dr. Cruz. And I've had now, this is on my third stem cell injection with PRP, and I've had good improvement. Not all the way, but I know that with the severity of my disease that I'm probably gonna looking at months to complete the recovery.
Did you see orthopedics, and did they want to do surgery? Or?
Yes, I did see my orthopedic doctor that I had been seeing for some time just to monitor this, and he said that he felt at this time there was nothing else he had to offer me except for knee replacement, which at 57 I was not ready to do that yet. And so.
And you are a nurse for how many years now?
A nurse for 31 years.
So you really beat up your knees working, 8 and 12-hour shifts. Would you agree?
Yes.
So when she first came to us, tell the folks how long you could stand, how many minutes before the pain kicked in.
I could probably stand in my kitchen and cook and just walk very short distances for about 10 to 15 minutes before I had to sit down.
And now how long can you stand?
Now I'm able to stand in the kitchen because I cook a lot and I'm in there a lot working for 2 hours.
Pain-free?
Pain-free.
Okay.
And then I just my knees start to get what I'd call a little fatigued, and
right.
They're ready to sit down. But then after some rest, I can get back up and do more things around the house.
Great.
So I've reached a lot of short-term goals.
And then that's standing, so you went from 30 minutes to 120 minutes. What about walking? How far could you walk? And you were using a cane before we started injecting you.
Yes.
Now are you using a cane at all?
Very seldom. Only if I'm going to go up and down stairs, I still need to use a cane, which I try to avoid that at this time till my recovery's more full.
Okay.
Because that's always been a precipitating factor for me that, the stairs are bothersome. But I'm now off the cane. I can walk about 30 minutes with just mild pain and tolerable pain. And
before how many minutes?
Probably more like 10.
Okay. So you went from 10 minutes to 30 minutes.
Mm-hmm.
And this is your third injection in about 3 months. And all these injections are going to be working on you for 9 to 12 months. So you've got a long way
Yes.
To see how much better you're going to get. And of course, she's a very disciplined lady, and she's getting physical therapy, and she's doing warm water therapy, which is the best kind of therapy for musculoskeletal joint pain, because that warm water heats up your joints and you get more blood flow. So if you can, for folks out there, if you can put heat on your joints, take a warm bath, of course be careful getting in and out of the bathtub, or even hot showers, because that improves the blood flow to the injured tissue. And you can alternate colds. I favor heat, but you do whatever gives you relief. And you don't want to take steroids or ibuprofen when you're doing these injections, because they if you have to, you can take ibuprofen, but they work against you a little bit. Well, thank you for this nice interview. Very helpful to the folks so that they don't get discouraged. Thank you.
Thank you.